Hello, Yvonne.
Good to meet you.
Pleasure to meet you. Please
Thank
have
you.
a seat. Welcome to the Prime Minister's office.
Oh, very nice to be here.
Thank you.
I'm here to talk about seniors issues, both from my own perspective and also because I work with the Seniors Resource Centre of Newfoundland and Labrador. So we get calls and inquiries all the time about services and resources. One of the main questions people have is financial, trying to make ends meet. And right now, the seniors in receipt of guaranteed income supplement are wondering where they're going to get their 10% increase.
Well, that was one of the commitments we made, to increase the guaranteed income supplement by 10% for our most vulnerable seniors, single low-income seniors, or low-income seniors living alone who need that support. And that's something we're going to put forward in this first upcoming budget.
In the budget.
So that'll make a difference in people's lives.
So it should be implemented quite soon
shortly
after that.
thereafter. Yes, that's the plan.
And that's a good start because that's $77 extra a month, which makes quite a difference. But that means they're still only earning or receiving $1,422, which when you talk to other people, they say, well, you can't live on that.
No.
So it's a start. And when the guaranteed income supplement first came in, people thought, well, they've dealt with the seniors issue now. They're not out of poverty, but they're still in poverty.
No, there's still a lot of work to do, which is why one of the things we put forward in re-engaging with the provinces on healthcare is we're putting $3 billion forward for better home care, so that we can actually support seniors as they age at home, as they want to keep a higher quality of life and give the support they need, so they don't have to be institutionalized.
And that's certainly what the majority of seniors want, unless they really have to need medical care. But when you're looking at enhancing or maybe national standards for home care, what would you include in that?
I think, well, a lot of it is to be worked out with the provinces. And one of the things that the federal government hasn't done in too long is sit down with the provinces to actually work out expectations around healthcare, national standards. That's one of the things that we're going to need. One of the other things we're talking about with the provinces that I know is a lot of seniors concerned is drug prices, medication. And we're working with the provinces to make sure that we're making pharmaceuticals more accessible.
Yeah, because that's important, because there's a patchwork across the country, and a senior moving from one province to another province may not be able to because there's a different, well, anybody actually, but seniors particularly, and then they can't get the medications they need. So you're really serious about a Pharmacare program? We are.
I mean, it's a step-by-step process. We're sitting down with the premiers to talk about exactly how we're going to do it. But there's obvious significant savings both for our healthcare system and for individuals to bring in something that's going to lower the cost of prescription drugs.
Yeah, and it might, in fact, it will help improve people's health if they get the right medications, but over-medication is sometimes a big problem. And one of the things I might suggest is that encouraging us in the issue of seniors is trying to recruit more gerontologists, because they look at the whole picture of a senior's multiple problems that they have. Whereas you might see one specialist for this and one for that. But there's only 250 gerontologists in the whole country.
Okay. Well, it's with the aging, the demographic shift. I know that's a real challenge for our healthcare system.
But this
in general.
challenge has been seen to be coming for years and years and years, and nothing's been done about it, or little has been done about it.
A little bit, not enough, but there's a need for general practitioners, gerontologists, family medicine doctors right across the country, and indeed our health minister is a former family physician who is very much seized with this challenge. We need to make sure we're keeping all the focus on empowering our seniors, respecting them, and including them in active community life as much as possible.
Which is what they want to do, and they want to stay in their own communities. But home care, as it is at the moment, is often just light housework. So that isn't enough to keep somebody at home because they can't maintain their place. But the other thing is, You get a snowstorm, snow outside, and the home care workers aren't allowed to do the snow clearing. Now, the Veterans Independence Program, they have maintenance program which includes a lot of things that could be included for other seniors, like maintenance, snow clearing, transportation to doctor's appointments, home renovations for people who need adaptation for medical problems. So I think it's short-sighted just to say more home care if it's just light housework.
No,
because it must be more. And the other thing is to have home care by doctors, nurse practitioners, physiotherapists, occupational therapists, a team approach.
That's actually what I think of when I think of home care.
Well, that's good.
Because the math is very simple. To keep someone in a hospital bed for 24 hours versus to provide someone the full care, the full range of care that they would need if they stayed at home, it's 10 times cheaper to do it the way their quality of life is best, still surrounded. In many cases, family members are still around who would like to help a little bit, want to be with their loved ones, but can't dedicate the kind of time and support necessary. That's where home care comes in terms of helping things out.
And another thing, when you talk about people caring for us, many seniors are also caregivers. And if they don't get this support in the home, their health is likely to collapse, and then they become the patient before the one they're caring for.
Recognizing all the connections that exist in strong and thriving families and strong and thriving communities is something that we have to adapt to. We've committed to bring in more flexibility around compassionate care leave for people who need to go on EI to care for a loved one who's going through difficulties. We've talked about home care. We've talked about Pharmacare. We're looking at a broad range of solutions, and quite frankly, input like yours is very helpful.
One other thing about seniors are often blamed for the high cost of care in hospitals, which, because they're the greater users apparently, but if they could be prevented from going in there in the first place, that would help. But the other thing that can make for a longer stay in hospital is some people feel that there's some age discrimination and they're not as important, and that's a perception some seniors have. But the other thing is hospital-acquired infections. Mm-hmm. And that's a hidden problem, and yet 220,000 people acquire hospital-acquired infections every year, and 12,000 die. Mm. And nothing is being done about it. And there's inconsistent data collection from province to province, and really we need to know where the infections are, right down to each hospital, each nursing home, and make it public.
I think, I'm a big believer in collecting data for better governance and for better ability to address problems like this. So I've certainly instructed our health minister to lean in on data collection, on coordinating with the provinces, so we have a more accurate picture of where the problems are, where the solutions are, and how to go at and address some of the systemic challenges that might otherwise, as you point out, go unseen.
Yeah, and I think once the spotlight is on, then it has been shown that, in one particular case, 25% less infections. And it needs a team approach, and it needs a great deal of coordination, and again, a national approach to it, I think.
Well, we haven't had a federal government engage nationally in a while on healthcare, and I know, as a Quebec MP, I'm very sensitive to areas of provincial jurisdiction or not, but there needs to be federal leadership on healthcare in partnership with the provinces who will be delivering it. But whether we talk about national standards, whether we talk about data collection, whether we talk about sharing best practices, whether we talk about challenging ourselves to come up with new and innovative solutions that can be applied across the country. These are the kinds of things that the federal government, particularly around proaction and being preventative, need to do much more of. Thank you, Yvonne.
Well, thank you very much.
What a pleasure to meet you. Thank you so much for coming in and sharing with me.
Thank you.
Appreciate it.
Bye-bye.